let's say it's a dilated, a very large ovarian vein with some, and or very large ovarian vein with compression of the iliac vein, how often are you seeing one and not the other, or both?
Yeah, I think the prevalence of left common iliac vein compression is so high that you often see both together. And so the sort of challenge here is to determine which is the more significant problem. I think we can get into the discussion of the nuances of how to distinguish one from the other, but quite honestly, at this point, there isn't a lot of evidence to guide us. But it is important for everybody to recognize how prevalent the left common iliac vein compression can be. A 50% diameter compression is seen in more than a third of people who come in for CT scans for any reason. And the same is true even for renal vein compression. Somewhere between a third and half of patients who get imaged for other issues will have more than a 50% compression of their left renal vein. So these compressive phenomena, we won't call them diseases, are common. And so when you do find evidence of ovarian vein or internal iliac vein incompetence, you often see it in concert with sometimes less significant levels of the compressions of these problems, which makes it easy if it's just a subtle or even just a 50% compression and the reflux seems to be the dominant problem and the symptoms fit those of reflux, then the reflex approaches or the reflex pathophysiology may be the more dominant one in that particular patient. But yeah, this is tricky and it's going to take a little time for us to tease out the best way to go at trying to distinguish them. But there's certainly some features, and we can get into that if you'd like, that may help.